Hi, everyone. Good morning, good afternoon, good evening. Thank you for joining today's Twitter space on advocacy approaches to safe and post-abortion care access. I am Eve Brecker. I'm the Associate Director of Civic Engagement here at PAI in Washington, D.C. Just to give a little background on our work here at PAI, for nearly 60 years, PAI has been working to advance universal access to sexual and reproductive health and rights through advocacy, through partnerships, and through funding changemakers. And PAI champions progressive policies and funding that make sexual and reproductive rights a reality for everyone, fighting to remove the policy barriers between women, girls, and other vulnerable groups and the quality of care, including contraception and safe abortion that they very much need and very well deserve. So today we will spend the next 45 minutes in discussion with two of our particularly treasured partners, two folks that I work closely every day with here at PAI, who join in this fight to remove policy barriers related to safe and post-abortion care access in both Malawi and in Zambia. Before we start, I just want to give a quick housekeeping update. So we've reserved the last 10 minutes for our audience to ask our speakers questions. To do so, click on the button showing the microphone. So identify where your microphone is in the left-hand corner of your screen. And you'll click that to request to speak. Our host will unmute you, and you'll be able to ask your question at the last 10 minutes of the event. So I want to set a brief stage before we get to our speakers, who I'm very excited to get to, and just give some context to today's discussion and why we decided to host this X Space today. You may or may not be familiar with the fact that today is a particularly special day. Since the early 1990s, September 28th has been recognized as an International Awareness Day around the critical need to decriminalize abortion. And PAI is proud to join this international annual conversation with the global community, as we, along with the community, are committed to safeguarding the right to bodily autonomy and access to quality, comprehensive, safe abortion and post-abortion care. Particularly through our reproductive health advocacy partnership, a project at PAI, we provide technical assistance to 5 partners in both Malawi and Zambia who are working daily to protect people's ability to make their own sexual and reproductive health decisions. And 2 of these partners are here with us today, ready to engage in a dynamic discussion on their 2 unique advocacy approaches to secure abortion, safe abortion and post-abortion care and rights at a national level. So with that, I love to introduce 2 of my colleagues, friends, and partners who will be joining me in discussion today. The first is Amos Mwale. He's the founder and president of the Center for Reproductive Health and Education. CRHE is a nonprofit that he began in 2005 to champion sexual and reproductive health and rights awareness and advocacy, specifically in Zambia. And with PAI support over the past several years, CRHE has served as the chair of Zambia's Ministry of Health's Reproductive Health Task Force, which is charged with facilitating key stakeholder meetings to review and update Zambia's 2005 reproductive health policy. His organization, CRHE, also supports the Ministry of Health in its ongoing review of the comprehensive abortion care guidelines, clarifying required approvals and hospital requirements for accurate implementation of these guidelines. By the end of this year, CRHE hopes that these comprehensive abortion care guidelines will be approved and shared with stakeholders to include a consensus between how the guidelines are being read, understood, and implemented between the Ministry of Justice and the Safe Abortion Advocacy Group, and that it's being implemented on appropriate terms. Our second treasured guest is Simeon Todi, who is
Thank
the
you
Senior
for the
Marketing and
introduction.
Advocacy Manager of Banja Mtsogolo, which is the largest nonprofit of sexual and reproductive health services
Anyone?
in Malawi. They provide about 65% of the entire country's contraceptives and contraception. Um, in our partnership with PAI and for short BLM, not to be confused with Black Lives Matter for those here in the U.S., Banja Mtsogolo, BLM is focusing this year on strategic interventions that expand access to post-abortion care in Malawi. And BLM seeks to reduce the number of deaths and injuries that are caused by unsafe abortions by raising literacy and awareness on safe post-abortion care specifically, and those practices to build a social movement demanding law reforms and ensuring that their reproductive health directorate operationalizes these post-abortion care guidelines. So we're very, very lucky to work with these partners every day and to sit with both Amos and Simeon on our X Space today. And I want to thank you for taking the time out to have this discussion, Amos and Simeon. So I'll get started with a question that I'd like both of you to answer, specific to your own work and context. I want to start with asking, what do you believe is the most urgent advocacy priority for abortion access, whether that's safe abortion care or post-abortion care, today in your specific context? I think I'll ask Simeon to go first. So Simeon, please let me know what you think.
Okay, thanks so much, Eve. So I would say, as a matter of starting, Malawi has one of the most restrictive
Yeah, we can
abortion
hear you,
laws.
please.
Yes, I was saying Malawi has one of the most restrictive abortion laws in the world, with the penal code of Malawi only permitting abortion to save a woman's life in danger. But the problem is the very same penal code falls short of defining what danger means. Does
Simeon, we're having some trouble hearing you. It's going in and out. Can you hear us?
Yes, I can hear you quite correctly. Can you hear me? Okay. Can you hear me now, Eve, and everybody?
Hi, Simeon. I'm able to
Yeah,
hear you.
sorry, I
I just
realized that
want
we're on a delay, so I think I interrupted you, but please continue.
Okay. I will start. I was saying Malawi has one of the most restrictive abortion laws in the world,
Yes.
with the penal code only permitting abortion to save a woman's life in danger. But the problem is the very same penal code falls short of defining what danger means. Does danger manifest itself in clinical indications? Does danger include other indicators like mental health? And who is supposed to certify that a pregnant woman's life is in danger, warranting a safe legal abortion? Is it a medical practitioner only? And what kind of medical practitioner? Are we speaking of a doctor? Are we speaking of a clinician? Or perhaps we're talking about a nurse? And how does that apply to different levels of health facilities, from community health centers, community hospitals, district hospitals, to referral or central hospitals, given that these facilities have different cadres of medical personnel? So to me, this is really urgent to bring sanity and the provision of abortion care in Malawi, defining what it means to say a woman's life in danger. Because if we just leave it up to the medical provider without even specifically defining what sort of a medical provider is going to be defining what it means a woman's life to be in danger, we're going to be denying thousands of women and girls in Malawi, most of them poor and vulnerable, to the service of safe legal abortion. So I would say for me, what needs to happen urgently is defining this danger, and how it applies in the context of abortion.
Thank you so much, Simeon, for that wonderful response. I particularly like that you're giving an example of what advocacy can mean, because I think sometimes for people who work outside of the advocacy space, a lot of times we think that it's only, working on national policies, and you're giving a specific example of rather policies and things, guidelines that have already been passed, but that a lot of our advocacy work is just trying to more clearly define what we're talking about so that folks know how to implement the policies that are already in place. So I really appreciate that example. Amos, same question to you. What do you believe is the most urgent advocacy priority for safe abortion access in Zambia today?
Thanks, Eve, and thanks everyone else who's listening. So for me, Eve, I think the most urgent issue in terms of ensuring that women have access to abortion is that we need to ensure that we have consistent information that we are giving out to women. So for instance, we know very well that Zambia is one of the countries that has a very liberal policy when it comes to women's rights and accessing safe abortion activities. However, the interpretation by the different stakeholders, the interpretation by the different actors is the one that hinders women from accessing safe abortion services. It's clear and the guidelines are there and you know what you need to do. However, people and the other parties also feel that abortion is illegal in Zambia. There is nowhere where it says abortion is illegal. It's illegal under certain guidelines. So it's our role and responsibility that with those guidelines we are able to sensitize people to know and understand so that we are able to save deaths that have occurred. We are also able to save maternal deaths that are happening currently. With that information, just the empowerment, you'll be able to notice that we are vetting a huge number of unsafe abortions that are happening in the community and saving women from maternal death. Thank you.
Thanks so much, Amos. And I love the second advocacy example you've provided, kind of building on what Simeon mentioned, that it's not just defining the policy, but also ensuring that the public understands it, because public opinion is a very strong influencer in national policy. A lot of times, people's voting habits drive change. And so people's understanding of what the policy is almost equally as important as to what the policy actually is. But if people don't understand it, it's not clear how it's implemented. You can face unnecessary barriers. So I appreciate this messaging around ensuring that policies are messaged consistently, so that people are well aware of, what is legal within policy frameworks versus, illegal. Amos, I'll have you continue. So this question is specifically for you. You are a long-term trusted partner of the Ministry of Health in Zambia. You focus a lot of your time with CRHE on a national decision-making level, particularly around liberalizing abortion access and building community among you and your peers, other people who work in the technical sexual and reproductive health space. I'm wondering if you could spend 5 or 10 minutes just explaining to us specifically the Safe Abortion Advocacy Group that you chair, and then how this group is working to reconcile the language in the National Comprehensive Abortion Guidelines. Can you talk to us a little bit about that?
Sure, Eve, thank you so much. So for us, as a Center for Reproductive Health, we focus our work in ensuring that reproductive health is actually what health around the 40% Zambia is health right now. Currently, Eve, you just mentioned CRHE is the chair for safe abortion advisory. Our work is to ensure that we consolidate what the policies that the Ministry of Health and the guidelines that we have developed are actually implemented. One of the challenges that we have had, like I earlier mentioned, I think it is the interpretation of what it means when we interpret these policies. So let me begin by the example. First, when you look at the Zambian law clearly stipulates in terms of how one can access safe abortion services. The health facility. Now, with the health facility, with time, this law we are talking about was enacted in 1972. So in 1972, we didn't have medical and medical and doctors act, which states who actually can provide. So in the law, it says that the medical personnel can provide. But when you define who a medical person who um, has gone and the full training of medicine. It's not only a doctor. So here we're talking about a clinic officer, uh, can be someone who is a medical personnel. When that is interpreted, so people feel it's only a medical doctor who should be able to actually authorize when the procedure should be done. That's one. Secondly, when you look at those guidelines that we are currently working on, they need that the Ministry of Justice, the Ministry of Health, and other ministries, so for instance, the Ministry of Gender, are all speaking the similar language or the same language when it comes to service provision. Once any of these differs, then you're already conflicting in terms of what you are telling the people. So, for instance, right now we are discussing or in discussion with the Ministry of Justice, who has guided in terms of the importance of what the law states and who should provide these services. And he has also guided, if we want to do any amendment, that we need to look at the law and what it says. But how does that do? Anyone who works around issues of abortion, there is a lot of opposition. You might be aware that Zambia is a Christian nation, and people are already looking, and people are writing to the Ministry of Health, Ministry of Justice, others to the President, that the Ministry of Health actually doesn't follow the law, and there are some people who are promoting abortion anyhow, anywhere. But when you look at the current law, it clearly states under what circumstances this service can be provided. So that's one of our roles. Secondly, we are also trying to ensure that there is quality in terms of when the service is provided. Where is it done? Who is doing it? How is it done? Because once we don't put in place those measures to ensure that there is quality of service being provided, we risk having more unsafe abortion. We risk people not coming for the service. So that's the reason why this safe abortion group is there, to ensure that we work closely with the ministry, and the ministry action is abide by what is guided in the law, and then also what the other stakeholders and the ministry is actually doing. That's number one. Number two, our role is also to ensure that stakeholders and partners are speaking the same language, and they are advocating that services are not discriminatory. We are also ensuring that these services are accessible by all women. It's unfortunate that sometimes services are only accessible by people who have resources. So we don't want this discrimination. We want to ensure that everyone who needs the service actually has access to it. In that manner, you will be able to notice that people are able to access the service without any discrimination, and they are able to access the service that is quality. Thirdly, we are also ensuring that the Ministry of Health, together with partners, are working together in recording and also documenting best practices that helps us to improve the services that we are giving out to the people out there. Last but not least, we want to ensure that the law is modern and the law actually is moving with time, to ensure that right now we are speaking about medical abortion. We are advocating that when we are doing this service provision, we are advancing with what WHO recommendations are. We are working with the ministry together with other stakeholders to ensure that we integrate or domesticate what recommendations are coming from WHO, to ensure that the safety and there's also quality of service that is being provided when it comes to service provision. Thanks, Eve, and I am happy to take any questions if people ask questions.
Thank you so much, Amos. I love that, again, like building on what Simeon had shared, that advocacy is one about, ensuring the public has an accurate understanding of particularly abortion laws, but then you have a multi-prong approach in a different direction where you work to coordinate different ministries. People who work in public health or advocacy may, just innately think that it's really only the Ministry of Health that's involved in creating and implementing safe abortion, post-abortion care policies. But as we have seen, especially in the US context with our Supreme Court decision, and also, as you mentioned in Zambia, that the Ministry of Justice is responsible for enforcing these guidelines that are produced by the Ministry of Health, that CRHE has a key role as the chair of the Safe Abortion Working Group in ensuring that these two ministries are coordinated, that they understand each other, and that they're implementing these guidelines in the same way so that women, people who can get pregnant, have as great access as they can, as is legal within the context of Zambia, and also that you are integrating the different civil society organizations and technical partners that are all working in this field to provide evidence to these ministries who are writing the guidelines, who are making the policies, so that the national policies and implementation are evidence-based. So I think that's great. Do we have Simeon? No. Okay. Unfortunately, we don't seem to be able to enable Simeon to respond. So until he's on? Okay, great. Thanks for rolling with us, folks. Simeon, I think you're back with us. So I have a question specifically for you. So moving from Zambia over to Malawi, the current Malawi Penal Code prohibits abortion, except to save the pregnant person's life. And Amos alluded to some of this in his work because the circumstances are similar in Zambia. But as he mentioned, these exceptions are often difficult to implement because there's a chilling effect when there's like one exception. Medical doctors may get nervous on exactly like what is allowed and what's not allowed, and may decide altogether that they just don't want to perform an abortion or provide abortion counseling, because they're, understandably not willing to put their medical license at risk. So it's important to understand that when people say abortion is legal in certain circumstances, that doesn't mean that it's accessible to all, because people interpret the legality in different ways. And it's the people who are directly involved in providing services who need help interpreting the legal parameters correctly. So as a result, we know that unsafe abortion, as a result of unsafe abortion, women are dying because they're obtaining these services anyway outside of medical settings. And your organization, Banja Mtsogolo, BLM, is trying to address this in part through advocacy efforts to support, one, bringing Malawi's termination of pregnancy bill to a vote, and specifically by engaging local religious leaders, faith forums, and other religious groups to secure support for safe access to abortion as well as post-abortion care. Assuming you are able to speak now, are you able to tell us a little bit more about this work? I'm not sure if we're on a delay. Simeon, are you able to respond to the question? Okay, unfortunately, I don't think Simeon is able to connect to his microphone, so we're gonna have to move on. Simeon, if you are able to connect, you can just message us through WhatsApp. So I'm gonna move on to a question that was for both speakers, but I will ask Amos to start us off. So Amos, for you, there may be folks on this call who are interested in replicating the work that you just discussed, both in, Southern Eastern Africa, Africa as a continent, or across the globe. And I'm interested how you might suggest that peer organizations in reproductive health advocacy, or maybe just health advocacy, how other civil society organizations could follow your lead in moving to abortion rights advocacy. Could you share your thoughts with us? Amos Smalley, are you still with us? It looks like you're muted. Nice. Hold on. Okay, so we have Amos back. So Amos, please go ahead.
Thanks, Eve. And one of the things I wanted to mention when you were explaining before, Simeon, about how the law is interpreted, I think it's important that first and foremost, we need to understand that in Africa, it will be very, very difficult to have a clear law the way the law is in South Africa. Right now, the anti-abortion movement or the opposition has grown more stronger. I can mention to you that this morning we are dealing with a case. I will share a letter with you and Christina, where we are dealing with a case in Zambia where they are actually now trying to censor the words and what kind of language we need to use in reproductive health. So with that, how do we work from now onwards? The first thing I want to mention is that we need first and foremost to understand what does the law state about safe abortion service provision in the country. That's number one. Number two, we need to identify which opportunities are there either for law revision or for advocacy, and then also what opportunities are there to ensure that we are able to engage either with the different ministries and they are able to understand. With the growing opposition that is happening right now, it will be very, very difficult for us to actually achieve law reforms when you look at the way the movement is moving, especially in Africa. I am glad that our colleagues in Mexico, they were able, maybe we should even learn more from them. Their constitutional court was actually able to grant them more and ensure that reproductive health, especially rights to abortion, is now part of the constitution and women have access to services. To make accessible services for women, we need to sensitize first and foremost women themselves to know why it's key that they are able to make these choices and then also to make the service available. So there is need for women to demand for the service. If they don't demand for the service and only men are talking about it, a few women, the opposition is using that opportunity to say, look at the people who are actually advocating for services for abortion are men and not women. Why is it that women themselves are not in forefront to actually advocate for the services and make the demand? Get allies in the ministries, especially the Ministry of Health, because they are the one.
Amos, are you still?
Also, the deaths that are coming even from unsafe abortion. If I can hear you, are you able to hear me?
Yeah, disconnected for just a minute, but please keep going.
Yeah. So I was saying, that the country needs to look at the statistics in terms of the numbers of people who are dying from unsafe abortion and the consequence and the gain what? You realize that the cost of you treating those unsafe abortion is higher than providing a safe abortion services. And then we need to also use those stories from women who have actually decided to undergo a service themselves by choice as an example than listening to the opposition.
Thank you. Yes, thank you so much. Does that conclude your comments? Okay, great.
Yes, it does.
Okay, thank you so much, Amos. I heard a couple great tactics that you shared for folks who might want to move into the space. One is obviously looking at other country examples. You named Mexico, which a lot of us in the field know recently decriminalized their abortion policy at a national level, has now implemented this across the country. You also talked about sensitizing women to understand their own rights, because if they don't know that abortion is legal in certain circumstances, they don't know which circumstances where they can demand services. So that involves, public health training. Also, giving women opportunities to advocate for themselves, and then looking at statistics so that we are making evidence-based policies. I think that we have Simeon back on the line. Simeon, can you hear us?
Yes.
Awesome.
Can you hear me?
Yeah, I can hear you great. I'm so glad that you could return to the discussion.
Yes.
I had set up a question for you to discuss further your work with BLM. Did you hear the question that was for you? I'll repeat it in brief.
No, I got the concept loud and clear.
You got the concept? Okay, well, just to remind folks on the phone, I was asking Simeon if he could tell us a little bit more about his work in advocacy towards bringing support for Malawi's termination of pregnancy bill and engaging local and religious leaders, faith forums, and other religious groups to secure support for safe access to abortion care as well as post-abortion care. So, Simeon, I'd love for you to take that question and run with it.
Yes, I was saying it is important to start by mentioning that it is in the nature of every advocacy issue or agenda to have supporters at the opposition. Now, for Malawi, the biggest opposition to abortion law reforms lies in religious leaders. Memories are still fresh in the minds of most Malawians when powerful religious leaders, led by the Catholic Church and others, organized demonstrations to Malawi Parliament to protest efforts by the Malawi government to reform abortion laws. Now, over 90% of Malawians profess a certain faith, and religious leaders are powerful influencers in any public policy discourse. Now, with abortion popularly being regarded as a sin, that's direct killing by many faith groups and believers, it has been a very tall order to make abortion law reforms a popular agenda. Now, we realized this as a BLM, and we realized that pushing the termination of pregnancy bill in Parliament without convincing the religious leaders, without bringing them on board, was going to be an exercise in futility. So what did we do? Together with our partners that we work with in advocacy, we started conversations with the religious leaders with the purpose of bringing them on board with abortion law reforms. So we invited powerful and influential religious leaders from very big denominations to a values clarification and attitude transformation exercise. Now we had to use different strategies to convince them, including inviting women from their own churches who had experienced the devastating consequences of unsafe abortions to tell their stories. Now, this approach appealed to the religious leaders, with very few getting convinced and getting on board with abortion law reforms. And fortunately, the few included an influential Catholic priest who went on to do a research on scripture, citing areas where abortion is justified. Now, his idea was to refute the popular belief that the scripture completely forbids abortion. And using this teaching that he used to cite different scriptures that actually support abortion, he went on to engage members of parliament with the teaching. And he also convinced and recruited other religious leaders to come together, leading to formation what he has now to be known as the Religious Leaders Network for Choice. Now, this grouping has become very strategic in abortion law reform advocacy in Malawi. Because they developed this teaching to say, look, abortion isn't completely forbidden by scripture. In fact, there are certain verses in the scripture, in the Bible, in the Quran, that actually support abortion. In fact, all religious denominations have got a teaching that support abortion. In fact, the Catholic Church has got a teaching in canon law that supports abortion. In fact, the Church of England supports abortion in certain circumstances. So they have used this sort of teaching, and they have started engaging now members of parliament. They have started engaging the media to write posters on abortion. They have started engaging, other religious leaders that are at choice, and they are giving talks, using TV talk shows, using community radio panel discussions, using position papers. The idea is to refute the teaching to say, when it comes to abortion, religion simply says no to abortion. You cannot talk about abortion if you are religious. So these religious leaders are saying, no, you can actually discuss abortion when you are religious. In fact, there are circumstances where scripture in the Bible, in the Quran, accepts abortion. In fact, there are circumstances where the powerful Catholic Church accepts abortion. In fact, there are circumstances where, different churches accept abortion. So this, for us, has become very strategic in bringing a lot of religious leaders on board to support, abortion law reforms, and then pushing back the agenda to the members of parliament to say, look, you have always been saying, because this country is known as the God-fearing country, so we cannot discuss abortion in parliament. But look, these religious leaders are actually saying abortion is justified by scripture. Abortion is justified by teachings of different churches and denominations. Abortion is actually justified by different doctrine. So this is how we have engaged religious leaders. So their teaching is now, they are calling the teaching the theological basis for abortion, isolating scripture in different holy books and in different, teachings of doctrines of different churches that are actually supporting abortion. But that's how we are engaging religious leaders in terms of abortion law reform and focusing on.
Thank you so much, Simeon. That was a fantastic response, and I love that you're giving yet another tactic example. How, it's not just about clarifying or defining what the law is, and it's not just about, what Amos was discussing, coordinating different policymaking actors, but it's also about influencing, or as in your case, refuting, um, you know, opposition evidence that's being brought to decision makers in order to change or sustain a policy. So this is an interesting facet that we haven't heard yet. I'm gonna keep you in the hot seat because I had asked Amos a question that was intended for both of you, and now that you're back with us, I'd like you to respond as well. I had asked Amos that for those on the call who are interested in replicating the work that you do in Africa, in the southern Eastern Africa region, or across the globe, how might other civil society organizations follow your lead?
Okay, thanks, Eve. I would say the starting point is defining the advocacy agenda. What is it that they wish to achieve? By when? And who is the decision maker in that advocacy agenda? Because an advocacy agenda is a dream. Currently, we have a dream. We want to have a Malawi where safe legal abortion is going to be accessible to all Malawian women and girls. How do we do that? We do that by, changing abortion laws, increasing grounds under which safe legal abortion can be procured legally and safely in Malawi. Now, who has got the power to effect that? Who has got the power to move this sort of agenda from a dream to becoming a reality? You see, that is members of parliament. Now, from there, members of parliament are already divided on the issue. Others are already, of course, pro-choice. Others are not anti-choice. And you'll see that those who are anti-choice, they have their own reasons why they do not want abortion laws to be passed in parliament. Most of these reasons, you'll see that they're coming from the opposition. So, as a matter of the next step, it is also important to identify, to do a mapping of who are your allies, who are the individuals, which organizations support, the advocacy agenda that you are pursuing. And then you look at the opposition. Who are the opposition now? What sort of groups do not like your advocacy agenda? What are their arguments? What are they saying? What are their tactics? Why don't they want, your advocacy agenda to be pushed, to be passed, to become reality? Then from there, I think you can now start dreaming of developing messaging. Messaging that is going to strengthen the allies and put them together, coordination, which is something that Amos spoke to, but also messaging that is going to speak to the opposition, because sometimes the opposition speak from a point that they do not understand. They speak from the point of information disorders, in misinformation, in disinformation, and malinformation. So when you develop that messaging, then you can start engaging different groups. You want to reach to members of parliament, but members of parliament are influenced by who? They are influenced by traditional leaders. They are influenced by the media. They are influenced by religious leaders. If you reach directly to the members of parliament without engaging the media, without engaging the religious leaders, without engaging the traditional leaders, members of parliament will simply throw away your agenda to say, we do not want to listen to you because you have not consulted those people. This is not in line with our culture. This is not in line with our religion. This is not in line with what actually the media is reporting every day. So before you actually reach to the level of engaging, the decision maker, it is also important not to omit the influencers. Those are the groups, those are the people that have influence, profound influence, so to speak, on the decision maker. And then you can now go to the decision maker with messaging that is targeted to the different decision maker. If it is parliament has got different people. There are people that are, like in our context, there are people that are in the budget and finance committee of parliament. If we want to engage those people, we cannot go to them and tell them, hey, guys, pass the abortion laws in Malawi because 18% of women are dying because of unsafe abortion. That messaging does not appeal to them because these people do not really care about that. They care about money. So we need to devise a messaging that is going to speak to money. So we tell them, unsafe abortions are actually draining 400 million Malawi kwacha from the government coffers because of post-abortion care, which is expensive. And then they'll sit down to say, but what can we do with 400 million kwacha? We can actually construct 4 school blocks in rural areas for girls who actually are learning under the trees. But we could use this money to construct those schools, to construct those school blocks if we actually pass the abortion laws and consign unsafe abortions to history. So I would say those are some of the steps that need to be followed in terms of replicating the work that we're doing.
Thank you so much. I feel like you just walked us through a comprehensive plan around how we can define our advocacy agenda. But I take your points that if folks are, maybe you work in health, maybe you work in reproductive health, but not abortion advocacy specifically. I think it's important to reiterate what Simeon noted, which is start with the advocacy agenda, start with what is your organizational strategy and what are you trying to accomplish in liberalizing abortion access, because there's a lot of different routes you can take. You have to know what your advocacy priorities are, when you want to accomplish them by, and you need to understand the landscape in which you're working, which includes major players in opposition. So as Simeon said, influencers in this space, and the culture in which you're working, religious, social, etc. You need to understand the landscape and then define an advocacy agenda specific to that landscape. Thank you so much for that, Simeon. Okay, we have both of our speakers on. And I'd like to flip it over to the audience and open it up to any questions. So if you have a question for Simeon or Amos, you can look at the bottom left of your screen for the microphone button and request to speak and ask your question live. So I'll give a minute for folks to digest our discussion and request to speak if you have any questions. All right, we'll give it another minute. Okay, we have a question. The speaker is connecting. Olga, are you with us? Okay, we have a question. All right, Olga, please go ahead with your question.
Hi. So I was wondering, I've been working in policy advocacy around abortion for a while, and we all know this can be fairly difficult and heavy work. So I was wondering if either of you could tell us what keeps you going, and how do you practice self-care, and what inspires you to keep advocating on safe abortion?
Amos or Simeon, don't both jump at once. Who would like to start?
Thanks, Olga, for the question. That's a very, very important question, and right now I think what is important is we all need to discuss self-care. So I think for me, what keeps me going is the issue to ensure that women have the right to decision making, and then also they have the right to access the services that they need. However, to do that, you need more energy, you need more networking. But if you look at our work practically we have to work all the time. I do extra stuff other than just this work, which is one, I do a lot of workouts. I don't like anyone taking out my 2 hours from the gym. I stay away from the phone. I have now included part of the exercise. I'm doing some runs. I run maybe 3 times a week. It's important that we stay away even for 1 hour or 2 hours, not only from the normal work that we do, even from the phone, just to ensure that we are not distracted and pay attention to other things that are happening in life. So that keeps me going.
Thanks so much, Amos. I'm with you about workout. I don't like anyone to get in the way of my exercise. And my workout of choice is boxing. I don't know what yours is.
I also do boxing here. So I do boxing on Tuesdays and Wednesdays. But I combine a lot of things, and I mean the unique part also, which I want to mention, those who work out, I use different trainers. I get a variety, so I benefit from all of them. It works out for me well.
This is great. I'd like to do a poll at some point about how many abortion advocacy folks like ourselves all do boxing, or if there's an exercise of choice between us. Simeon, do you want to respond to this? What do you do to keep yourself going?
Yeah, what keeps me going first and foremost, of course, is the passion for writing. Apart from the work that I do, I also write and run a column in Malawi's super popular newspaper, the Malawi News. So they specifically gave me a column to write on modern contraception. Now, I use that column specifically to express my thoughts every day, every week. Looking at the new trends and developments in terms of sexual and reproductive health care, including modern contraception, abortion, and safe abortion. So I just like writing because I think that was part of my training, way back in college. And it's really exciting to look at the feedback that comes through the editing of the newspaper when I put up something. Like, for example, this week I'm writing on the need for Malawi to decriminalize abortion. So it's going to come up tomorrow, and every day or every Monday, the editor collects the feedback and sends it to me. Lots of people are going to say, no, that was a very good point, that was very good, right? That keeps me going. But also the people that say, how about if you could have done it this way? What do you think about this? The kind of feedback that comes in form of constructive criticism, that also keeps me going. Apart from that, I have got something that I do on part-time that I do without a passion, which is farming. So farming takes away sometimes all my thoughts and absorbs me into something else away from, all the advocacy, sexual and reproductive health. So that's what keeps me going in that part.
I'm glad that you ended with the farming, because I got a little concerned for you, Simeon, that your escape from the abortion advocacy work was writing more on abortion advocacy in your own column. So I'm glad to hear that you have something else. I don't do farming, but I have a lot of houseplants, so I can share in that interest with you. I wonder if anyone else on the call has a question. So thanks to both speakers for sharing. Anyone else have a question? Okay. Without someone speaking up, I got a question that was sent to me in WhatsApp. Oh, it looks like Katie has a question. Katie, are you with us? Okay. The last question that I'll end on for both of you, I can't seem to hear Katie's question, is that could you just briefly, in a few sentences, tell us how you found yourselves working in abortion rights? Some of our listeners may or may not be working in abortion advocacy. And I think a lot of us would be interested in hearing very briefly just a little bit about your background before you got into reproductive health and how you landed in your current work. And I think that would be a nice way to close today's discussion. Simeon, since we still have you off mute, why don't you start and then we'll flip to Amos.
Okay, so almost all my career, except maybe a year or two, and we're talking of a career that has spanned through close to 13 years now, I've been in reproductive health advocacy. So I started my career by interning for a local newspaper for a month or so, before I went on to join the Catholic Church, one of the development commissions as a communications expert. Then from there, I took a twist, and then I joined a gay rights, campaign group. That's an organization that does advocacy around minority rights in Malawi as a communications and advocacy specialist for a number of years, actually. And then from there, that's when I made yet another switch, but not a switch moving out of the sexual and reproductive health advocacy, but I simply switched and decided to start advocacy around, access to family planning, abortion, and post-abortion care. Now, the question is, what happened? When the Special Law Commission in Malawi released a report on the magnitude and impact of unsafe abortion in 2016, the churches formed
and organized themselves to organize mass demonstrations. Now, they lumped up two issues in these demonstrations. One topic was going to parliament to oppose any efforts to discuss the termination of pregnancy bill, which had been developed by this time. And then the other effort was not to allow anybody to tamper or to change or to legalize, what they called homosexuality in Malawi. So they had two issues which they had lumped up in their demonstrations. Now, I went to attend those demonstrations because by this time I was working with this organization which was doing advocacy for minorities. But then this time I had very little knowledge around family planning, around access to safe abortion. But when I joined the demonstrators and then we got to parliament. Now, the reason for joining the demonstrators was not because I wanted to demonstrate or that I agreed with their agendas, but because I wanted to hear, since I was waiting for the other section that they were demonstrating against. So I wanted to hear exactly what they would be presenting to parliament. So when they went to parliament, they started by presenting the proposed termination of pregnancy bill. So I got interested in that because had to look at the magnitude study to say how big is the problem of unsafe abortion in Malawi. Who is terminating pregnancies in Malawi? Why are women and girls getting attended pregnancies in Malawi? Why are women and girls, terminating pregnancies? And where are they terminating the pregnancies? What problems are they facing when they terminate the pregnancies? So that sort of report got me interested to say, look, I think there's a room here sort of to strengthen the advocacy agendas and a little bit of communications plus marketing. And when the BLM was looking for someone to fill in the shoes of advocacy and marketing, I thought it was time for me to join the advocacy movement around safe abortion in Malawi. So that very same year, I also applied to the newspapers to give me a column where I could express myself in terms of access to modern methods of contraception, as well as access to safe abortion. So that's how I found myself here. So it's been a journey of 6 years now.
Wow.
And still counting, I would say.
That's great. Simeon, it's so interesting to me, and I think maybe inspiring and encouraging to others listening in that, folks who work in abortion advocacy now didn't necessarily start in this career, and that folks' professional journeys can be very circular and very rarely linear. So I think it's interesting to hear how you started out versus where you landed. I won't share my story today, but it's similar. I didn't start out in abortion advocacy or even reproductive health. Amos, we're running quite short on time. Do you want to share on this question, or should I move to close?
So if I all my career I've done reproductive health and health. So okay. I'm not like Zaim Simeon or any other people. I started from high school. I was trained as a PAI educator.
Wow.
Went further to do PAI education. When I finished school, went to the university. I carried on my work until then. What I have done is I've studied public health my entire life. That's all I know. Thank you.
Well, you're nothing if not consistent, Amos. And I think it's nice for people to hear the other side of the coin. I think you are very lucky that you found your passion early in life. And I'm so glad that, Zambia has had you and the world has had you as a skilled, technical abortion rights advocate all of these years. So just to close, I want to thank both of our speakers, Simeon and Amos, for their time, and thanks those on this call for jumping in. I hope that folks find these conversations inspiring, because quite often in the news and the media, we're kind of bombarded with negative stories around people who can get pregnant, losing their rights more often than not. I saw an interesting article from the Center for Reproductive Rights the other day, though, that countered this data that I wanted to share with the group, just to end on a high note. That across the globe, 60% of people of reproductive age are living somewhere where abortion is legal. And it's particularly high in Africa, in the continent. I can't speak specifically for Malawi and Zambia, but particularly high in Africa as a continent, where there's 24 countries that have liberalized their abortion laws over the last 30 years. So, despite a lot of times what we hear in the media, globally in the U.S. or in our national context, we are making progress over the long haul in expanding people's access to critical health care.